This is Alan Weinkrantz with the Rackspace Startups Program. I'm here with Peter Neumann, and Peter, you're going to be one of the panelists at the upcoming mHealth conference. First of all, welcome to Israel.
Thank you so much.
And give us a little bit of background about yourself.
Well, I'm the CFO of one of the major hospital groups in Germany. It's a privately owned but also stock market listed group with 1.2 billion sales, 15,000 employees, and we're focusing only on the high end of the medical spectrum, meaning acute specialty clinics and university clinics. My background, though, is not in medicine. My background is actually 25 years of being in capital markets and investment banking. And I joined the supervisory board of that company, and a few years later we had a transaction. The strategic transaction failed, and the chairman asked me to step up and become the CFO. So now I'm in my second career, and I'm very happy to not be in banking anymore.
Okay, so what brings you to the conference?
Well, we have been working with our Israeli partners over the last 10 months very intensively. If you want to put your money where your mouth is and you're only focusing on the high end of the medical spectrum, then you better know anything about innovations in the fields that we mostly cover and in the cases that we mostly cover. That means that conference for me is a fantastic way to meet new companies, to meet startup companies. We're very, very engaged in the startup company fields in the areas that we cover, which is medtech in the 5 major medical areas and in IT, telemedicine, etc.
Okay, so when you say the high end, do you mean for private patients or do you mean...
No, 90% of our patients are statutory health insured.
Okay.
10% are privately insured. Private, I mean, we're privately owned. We're not owned by the government.
Right.
We're owned by 50% of free shareholders, basically the usual suspect institutional shareholders. 50% are owned by 3 strategic shareholders. One was the founder, the one is a huge medtech company, B. Brown, and another one is another hospital company.
Okay. Now, Israel has socialized medicine.
Yes.
Where do you see a vector? Where does it intersect where you have all this innovation here, all these wonderful startups, and this, the stuff costs money, to either fund, grow, and even implement in a hospital, but yet we have a socialized medicine system here. Do you find that having a social system either hampers or accelerates the process of innovation? And where does either just sheer business intersect with advancing humanity and advancing healthcare?
Well, I would be a poor judge to comment on the Israeli healthcare system because I frankly don't know too much about it. But I'm not really here to liaise with the Israeli hospitals. I'm here to liaise with the startup companies that can give us access to new technologies that don't exist yet. We are very much working, like any big hospital groups, we're very much working with the usual suspect in IT and medtech, the global guys. The global guys, of course, have fantastic products, but I find them in a lot of ways rather slow in decision making and in coming up flexible solutions. On the startups that we want to liaise with, this works a lot faster, they're a lot more flexible, and what we offer is basically giving the startups a chance to work at our hospitals, do pilot with us, do pilot with our patients, with patient data, which we believe is a huge advantage for these startups because, frankly, a lot of the startups we've been meeting, and believe me, we have met a lot, have operations in Israel and then have an operation in the US because this is usually where the funding from the VC side comes from. Germany is the biggest European economy, and giving the startups a chance to do a pilot, with a very well-established clinical group in Germany, usually is even more interesting for these startups than giving them startup capital. So we think there's a true win-win situation. We've done a lot of homework. We believe that model that we have established is pretty unique. I have yet to find anybody else that has the same model. So basically combining 2 sides of the same coin to make for the better good.
I personally spent September the 12th through October the 10th living in Berlin. I was in the startup ecosystem there, not necessarily in mHealth or in medical, but in the startup ecosystem of Berlin, just Berlin itself.
Right.
And I have to tell you that sometimes, you forget that here you sit in Israel, You can hop on a plane. It's a 2-hour time zone difference. You can.
Actually, it's one.
I'm sorry. Well, I'm thinking of London. I'm sorry. Yeah, it was 1-hour time zone difference. You can get business done in real time,
Yep.
and nonstop. It's like about a 3-hour flight, or if you have to stop in Istanbul, it's about a 4.5-hour flight. But it's Germany. Or actually, it was where I went to in Berlin. It was like Berlin and the major cities here are really, if you look at it in the context of the geographic size of the United States, one might be in New York, the other one might be in Dallas. It's not that far away. And so what I have to explain to people when I tell them, I went to Germany, I go, well, no, it's not that far away. And plus, the entrepreneurial spirit that's going on in Germany, the growth of the startup ecosystem, it is, I think you've brought up a very good point, that sometimes having trials and access to real case studies can far exceed, the benefits of simply
Cash.
of cash. Like,
Yes.
Here's some money, go do this.
Exactly.
Okay. I'm an Israeli startup in mHealth or in MedTech.
Right.
I want to do something. I want to come to you. How do I approach you and say, hey, we've got this thing. We'd love to try it out.
We have a partner here that we've been partnering for the last 10 months, and we've met many, many times and had dozens of phone calls, etc., to set up the system. So these partners who are basically based in Tel Aviv, but also in Palo Alto, so we are targeting the US market and the Israeli market, and of course the German market, but we do that ourselves, if you will. These partners basically have received, if you will, a shopping list from us. I was referring to the major diseases that we focus on in our clinics. Actually, 70% of our patients have diseases in the 5 major sickness cases: neurology, cardiology, lung, orthopedia, and the various oncological areas. On top of that, we very much focus, as I was saying, on telemedicine, anything tying up the countryside, the rural areas, to the clinics without having, especially the elderly people, constantly have to travel to the clinics. So these 6 areas, basically, we have a very clearly defined list of what we're looking for. Our partners in Israel basically have their own specialists on the ground that do the filtering for us, that do the very first quick and dirty, if you will, due diligence of the company, of the management, of the history. Are they very early stage? Are they late stage? We are somewhere in the middle. We're not going into the incubator stage, but we're not going to wait till the product is ready. We want to have at least one prototype that we can test out in the clinics, and through this partner, then we receive the first research. We evaluate the research in the investment committee. If we like the research, we ask the Israeli company to come over to Germany for a day. We get our main expert on their specialty field in. We do a 2-3 hours Q&A. And if we like what we see, and if they like what they see, then we start working about a pilot study. At the same time, we have our evaluator, which is another Israeli company, start doing the valuation to make sure we are prepared after the pilot, if the pilot is successful, to also invest. So I think the process is very well thought of. It works very well. Of course, it can always work better. But as I said before, Alan, I think we are the only ones that have that approach. Compared to regular VCs, we have basically the chance of doing the hands-on checking of the business model and of the companies, because we do the pilots with real doctors and real patients in real clinics.
Okay.
I think that's the difference. And that's why I'm actually
That's
convinced
super.
our business model, also for potential co-investors, is very advanced, because the risk, of course, by having the hands-on experience with your own doctors is a lot better than having independent advisors that you pay by the minute.
Okay. Best way to reach you. So I'm a startup. I want to come in. I've got something for you. Fits in one of the categories. What's the best way to reach out to you?
I think at the end of this interview, Alan, I'm going to give you the email address from our Israeli partner, because he's here, he's hands-on, he's been in the VC business for 14 years. So through him, and he's going to come directly to me, and I speak to him every day.
Okay, and that would be?
That is Aviat Kamara from HTC, High Tech Care, here in Tel Aviv and in Palo Alto.
Okay, great. Thank you so much. Great insights.
Pleasure.
Thank you so much.
Thank you, Alan.